Welcome to dBrief. I, Deepika, will take you through the highlights of the webinar, International Webinar on COVID-19 Pandemic, which was recently organized by IMA Pune on 8th of November 2020 and sponsored by DigiShield. The sudden outbreak of the pandemic for the past few months has created havoc around the world. The constant fight against the virus has reached the point where the world has started to lose doctors. It is only through conscious and steady steps that we can together win the battle against the virus. To create the awareness of the same and to update the knowledge as to how one should deal with the new phase of rising numbers, DigiShield joined hands with IMA Pune to have an insightful discussion and shed some light on the problem. Dr. Avinash Ponwe kick-started the session. President-elect IMA Maharashtra State 2018-19 started his lucid speech on the chosen topic, early policy actions and emergency response to COVID-19 pandemic, tears of our COVID frontline warriors. He began to share the horrific history of COVID-19, which suggested thousands of pneumonia cases in China. He further informed that the virus spread to various other countries like Korea, Japan, UAE, and Iraq. He reflected on the actions which could have been taken by the government to handle the situation better. To understand the situation better, let's dive into the video.
Things about the isolation, home isolation is also under a big question mark. Initially, it was told as 17 days, then 10 days, then 14 days. And now in Mumbai, at some places, the home isolation is prevented by the government, that you should not isolate patient for the home isolation. Even about the test, which is not to be done at the time of discharge, was announced in the month of May. But still we see that many of the patients, especially the VIPs and politicians, are tested again after 10 days or 14 days to see whether they are cured or not. There was a big problem in data collection also. Many times, even in Pune itself, around 3,000 patients were not registered. Few days back, around 773 patients were not registered in the data, and on a single day they were registered, and suddenly the number of patients were seen high. At Bhusawal, around the 23 swabs were found that they were not sent to the center and they were not tested. So many things came across rather in which the doctors were blamed. The doctors were blamed for everything, every wrong thing, and especially the private doctors.
Dr. Ravi Wankhedkar, IME National President, 2018 began to address his chosen topic, COVID-19 post-ICU care and future challenges. He started by sharing that the second wave cannot be predicted as the pandemic is filled with unexpected twists. He suggested that the pandemic hit different parts of the world insignificantly different and that neither of them can be related. He informed that the last 15 days data depicts the improvement in the condition of India, but certain states are still suffering has continued. He also predicts certain changes shortly. Let's know them.
What we expect and what we hope, ultimately we live on hope, that even though there will be a second surge in India, it will not be as severe as what we had in the first case. Secondly, the mortality from the second wave also would be much less. Because now our health systems are geared, the government, with all its limitations and policies, has definitely created a certain health infrastructure, not only for testing, but for treating also. The clinicians are now well versed in treating patients, and a well-established protocol is practically followed throughout the country, may it be public health or in the private health sector. So, with the vaccine still a distant reality, especially even after the discovery of vaccine, vaccination for 1 billion population is a nightmare. The logistical nightmare, the financial nightmare. Till that time, I think we as clinicians should be definitely on our toes all the while, explain to all the policymakers and the community at large the three cardinal important preventive measures of physical distancing, hand hygiene, and masking.
Up next, Dr. Indamohan S. Narula, who is the team leader in Global Fund LFA at Ulaanbaatar, Mongolia, started to address his topic early policy actions and emergency response to COVID-19 pandemic in Mongolia experience and challenges. He started by laying down the early preventive measures which were taken to restrict the widespread of the virus. He gave a brief idea about the risk factors which were surrounding the Mongolian crowd and also the active response of the healthcare professionals. He concluded by suggesting the lessons for consideration by other LMIC.
LMICs with smaller population are likely to be overwhelmed, low healthcare capacity, inability to implement adequate quarantine approaches, require stricter and more effective control measures, travel restrictions and prohibitions, and of public gatherings seems to be more important than the lockdown. Isolation and quarantine needed to be facilitated through government interventions, as most of the poorer populations do not have the means to self-isolate at home. If the government had not done this, there would have been much more serious consequences. So this initiative by the government was very helpful. It also made it easier for people to abide by the isolation and quarantine measures because they had a place to go and they were given resources and some support. Only they had to pay was for the food. Adequate resources, questions that were raised, I was listening to the conversations, adequate resources to develop healthcare systems. Prior to these emergencies, timely and relevant preventive response, anticipation of the outbreaks are important. This has been done. Mongolia has been fortunate to get the support of the World Bank as well as from WHO and has worked closely with WHO to prepare for this in anticipation. I think the key factor here being is that because it's a small country and is very centralized and has a very active Ministry of Health and close collaboration between the central government and the state governments is an important factor that has helped. That not to say that there are no problems and there are often challenges and that sometimes the state health departments want to do what they want to do, yet there is a considerable amount of oversight and supervision that is held out over there, and there are national standards that are followed and everyone adheres to these. At this time, because the Mongolians felt that they were a small population and they would have a big challenge and they could have really damaged their population and experience a lot of pain and suffering, they were very careful to prevent this from happening. And so far, except for the case that happened a year ago, there has been no internal or community transmission. Every case that we have identified over the last 6 months have been from overseas, those repatriated Mongolians that have come. So therefore, they were captured right at and tested at the border and appropriate measures were taken. Everyone that comes into the country has to go through a minimum of 21 days quarantine. And then depending on whether they become positive or not, they may be allowed to not have the self-isolation. Literacy rate has been a very important indicator, has been a very positive response because of the information and understanding by people. And Mongolians are often very comfortable to say that the importance of universal education has been a key factor in combating health issues and emergencies because information can go and everyone can read this information and pay attention to it and act on it. So, use of mobile phones, radio, television, continued business activities remotely, advanced preparation, robust preventive systems has helped Mongolia to mount an effective response to a pandemic. It is indeed possible. If it can be done in Mongolia, it could be done in other LMICs also.
Dr. Sharad C. Jaitley, who is a past clinical professor at Mount Sinai School of Medicine, began to speak on his chosen topic, Cardiovascular Manifestations in COVID, Perspectives and Experiences from the USA. He began by outlining the cardiovascular in COVID by showcasing the seriousness of the situation and then slowly describing the reasons behind the same. He shared the basic guidelines which one must keep in mind and necessary techniques to check on the patient's health. To conclude, He suggests certain points which one must ensure.
Conclusion, here we are. Troponins have a huge role, and likewise the BNPs have a huge role when you're assessing a cardiac patient first time in the emergency rooms. You want to prevent the myocarditis getting into the myocardial necrosis and into heart failure later on, and therefore all these dysfunctions that ensue. So your goal is to prevent the progression of the disease. Nothing like preventing the disease per se to get with, but the fact is that once the patient presents with COVID, your goal as a clinician is to try and prevent the progression of the disease, and that's where I think we come into our pictures here. Next, please. Use of CTA we have talked about, and risk stratification is very helpful. It's a non-invasive way to go, and vaccines are still yet to be released. They are there, hopefully by the end of the year or beginning of the early year. But I anticipate, this is my personal opinion, I think they won't be ready until April.
The webinar ended on a good note, where Dr. Peter Patel, who is an international director in Faculty of Disaster Medicine, India and Nepal, started to enlighten us by speaking on the topic Cure versus Prevention, a Global Health Challenge. He started off by sharing the brief history of pandemic with the help of Spanish flu. He laid down the points as to why the pandemic are potentially damaging, highlighting the condition of different parts of the country due to the COVID-19. To understand why vaccine is important, let's hear it from him.
In terms of vaccines, Russia and China have begun COVID-19 vaccination. They have not completed all parts of international clinical trial protocols. There are no vaccines currently available which have been emergency use authorization for COVID-19. Okay. All of those ones we are coming up to mention, they are under development and will need refrigeration at temperatures well below 0 degrees. So when the vaccine is available, to get it to millions of people, including countries like India, will require a cold chain. There is a report of an Indian scientist who claims that he has produced a heat-stable vaccine, which can be stored at 100 degrees for 90 minutes or 70 degrees for 16 hours. So that's, if that one actually comes out successful, then that will be a good innovation. United Kingdom. Well, the news here is that the NHS has already started asking the NHS doctors to prepare for vaccinating for COVID-19 by this December. And they said they have possibly, one of the 3 vaccines might be available. So contracts are going out, plans have been drawn up, and the first group of people who either plan to vaccinate are going to be NHS workers, at-risk workers, and people over the age of 85. Okay. AstraZeneca COVID-19 Oxford vaccine. So how does it work? This virus actually uses proteins from its surface called spike proteins, okay? And this particular COVID-19 vaccine is made up of another virus, adenovirus family, and that's been modified to contain a gene from SARS-CoV-2 spike protein. Adenovirus itself cannot reproduce and does not cause disease. So when the vaccine is delivered into a human body, into the cell, then the cell uses the gene to reproduce a spike protein. And that will trigger the person's immune system against this spike protein of SARS-CoV-2. So if later that vaccinated person comes into contact with the SARS-CoV-2, the immune system will recognize it and the virus will be prepared to attack it. So this is one of the different types of vaccine, okay? There is a social media scare that the virus gene will take over human body, but so far, none of the experiments, none of the trials have shown that a gene can take over human cells.
Mr. Dipen Mehta, a COO, DigiShield, took the chair where he discussed in detail how DigiShield is enabling doctors to safely and securely practice these testing times of COVID-19. DigiShield can conduct a quick and effective COVID-19 carrier risk screening of every patient before visiting clinics. To watch the entire video, please visit our website www.digishield.me and click on the dBrief menu.